Hi, I'm Dr. Wallace with Catawba Heights Animal Hospital, here to talk to you about your senior cat's care and needs. How will getting older impact your cat's overall health? Cats' nutritional requirements change as they get older, such as ours. They don't need as much calcium, higher protein, fats as they age. So we do recommend getting them on a senior diet as they get older, typically after age 9 or 10 years of age. Some signs that your cat may be slowing down. They're laying around more. You might notice they're not jumping up on the furniture like they used to. They don't go up and down the stairs completely. They might take a break on the stairs. You might notice that they look thin in their back legs or along the top of their back. That's just from muscle. The muscles aren't being used as much as they should be, so they're going down in size. Some common health complications or diseases that you see in senior cats, I would say the top 3 are going to be chronic kidney failure due to age, hyperthyroidism, which is an overactive thyroid, diabetes, and also, unfortunately, cancers. As we are getting better and better with medicine in both the animal and human world, we're seeing more and more cancers because we are solving or preventing, treating many diseases that used to not allow us to live as long as we are. So we're seeing more and more cancers because we're eliminating those kittenhood diseases. We treat for parasites. We do the dental cleanings. We keep your pet as healthy as we can. And the one thing we can't treat is cancer. So one of the things that's great with cats, especially because cats are the great pretenders in life, they hide disease very well. Once a cat shows outward signs that they're sick, they're really sick. So it's very important for cats to have blood work every year, maybe even every 6 months, depending on what they have going on, no matter their age, and still continue vaccinations because, like humans, as we get older, our immune systems weaken and they are more prone to catching disease as opposed to a middle-aged or adult cat early on. We do need to do wellness checks once a year, regular checkups. It's really hard to spot weight loss in a cat when you have a 10-pound cat who might have lost half a pound to a pound. That's 10% of their body weight, but you may not notice it because you see them every day, and that fur coat can really cover and hide a lot. So bring them in, having them weighed, having the doctor do a physical exam, looking at the eyes, the mouth, the ears, feeling the belly, that kind of thing can really help, and having blood work done. Blood work in older cats needs to include a thyroid check because cats are prone to an overactive thyroid. Testing for a heart enzyme called a proBNP, which tests for the stretchability or the stretch of the heart muscle, because cats can also get a common heart disease called hypertrophic cardiomyopathy that's really hard to detect without an ultrasound, or now we have this new blood test, which can be suggestive and help. The most important thing to know about your senior cat is we do need to see them once a year, even if their vaccines are not due. We do need to do blood work on them once a year because when things come up, it's much easier to treat them early on as opposed to waiting when they're really sick. Or if they have a disease that we may not be able to cure, we can start treatments early to help prolong their life so they're with you longer, as opposed to coming in and getting the bad news and having to make some decisions in the moment. If you have any questions, give us a call. We look forward to seeing your pet here, and we can get them in for an appointment for their wellness check and blood work.